Hi everybody, my name is Jennifer Lococo and I'm a naturopathic doctor and the owner of Lococo Wellness Clinic, and today I have the Medical Marijuana Practitioners Incorporated group joining me. So we have Heidi, who's the nurse, if you can just wave Heidi, and Dr. Mitchell and Lindsay. So Lindsay, you are the owner of Medical Practitioners Inc., correct? Medical Marijuana Practitioners Inc. Okay, and just give us a brief background, like what made you want to start this company? What was the reasoning behind it?
Well, it started with, we manage a walk-in clinic here, and back in 2014, 2015, we were getting quite a few patients who were coming in inquiring about medical marijuana, and Dr. Mitchell was always a supporter, but as time started going on, we had more patients who were actually naive and needed a little bit more education. So then we started hiring, or we thought we needed some nurses to actually devote their time to educating and supporting these patients.
Initially, prior to doing medicine, I did a neuroendocrine degree in physiology and I got my master's there. So prior to, the ironic thing is, prior to my doing medicine, had I stayed in that course, I would be studying this, as that's the field that
Right.
the cannabinoid system seems to involve.
Okay, and just to overview everything you guys just said, so Dr. Mitchell, you are a medical doctor and you own a walk-in clinic. And when patients were coming and asking you these questions, you found that time was of a sensitive nature because you didn't have that time to really spend with them. And because Lindsay manages the clinic, this was an issue that you guys were seeing together, at which point you decided, you know what, we're going to create a whole separate company to manage this so that we get best patient outcomes utilizing this therapy. So that's where the creation of Medical Marijuana Practitioners came in. And at that point, because Lindsay's busy managing the clinic, Dr. Mitchell is busy managing his walk-in clinic, we now have added on, well, you have added on nurses to that, you've educated your nurses to then be able to spend that 40 minutes with the patients and really go through their case history and really be specific about what you prescribe. And you were saying before that
Oh, that's a great question. I guess I would start with some of the main issues that people come in for are sleep, pain of any varying nature. Pain is a big umbrella term. Sleep and pain and anxiety, I'd say, would be the top three repeating.
Yeah.
Things that you guys said. Remember when a lot of people can buy from dispensaries or they can buy off the government website, the OCS, but they're not allowed to give medical advice. So here we have it where they are going to be prescribed a product, and maybe, like you guys said, the way you prescribe it's an individualistic approach. You're taking into account, like Heidi said, you're taking into account their comorbidities, you're taking into account maybe like previous drugs that they might be sensitive to or what their tolerance rates are. And you're really gonna, and like Dr. Mitchell said, you're gonna go low and you're gonna go slow, and you're really gonna work up, because you guys both mentioned that THC in combination with CBD is where those therapeutic effects are found. It's not just always just in that CBD. And that being said, when people go and they experiment on their own, or they're just going to the store and just talking to somebody randomly and getting that advice, that's where maybe that THC might be too high. That's going to trigger aggravations. That's going to make them feel worse. And then they're going to be completely adverse to the benefits of cannabinoids or to the THC, because they're going to think this doesn't work for me and it's not helping. Where in fact, it's just because they didn't have that proper guidance or that proper expertise that you are able to provide those patients. Is that correct? Yeah, okay. I wanted to talk about this. And Dr. Mitchell, you can really attest to this, and same with Heidi and same with Lindsay. You know, when we look at the medications that are being prescribed, whether it's for sleep, whether it's for anxiety, and for pain, with the opiate crisis, are you seeing a decrease in your pharmaceutical medication prescriptions with the use of this? Can you comment on that?
we see decreases in medications you don't normally, they're not here for those conditions, but we'll see them be able to get off, say, some diabetic medications or for hypertension. So it's quite fascinating that, you know, when they come in for one thing, then when they return, it's more this other issue that's being resolved that we didn't expect and they didn't expect. So it's interesting how it works.
It definitely is. I think so we have our initial appointment where we sit down and we do an intake of everything, and we work with the patient to facilitate the whole relationship. And that looks different for each person depending on their level of knowledge. Our follow-up appointments, though, are really interesting, and it's where you kind of get into the meat and potatoes of things with our patients, because they'll come in and now they have feedback to offer about what they noticed. And I always tell my patients that cannabis is a teacher medicine, because we learn so much about ourselves through delving into a relationship with cannabis. You learn a lot about yourself and how your body works and how it responds to you. And it's going to be very different for each and every person. Each and every person has a different response and a different story because we perceive pain, we perceive all of these things differently, right? We all wear a different lens. And so it's really interesting. They come back and they say, well, I came in here for anxiety, but it turns out I've actually gotten off my lorazepam and I don't even use those anymore. I haven't pulled them out of my drawer in a year. Or, you know, so it's really interesting.
You guys being conventional medicine, how do you feel about that they're getting off the drugs?
Oh, absolutely.
It's awesome. It's fantastic.
Because we deal with the side effects of all these drugs most of the time.
Yeah, it's so exciting when someone can say, I am now on a plant-based medicine versus, you know, pharmaceuticals or man-made chemicals, right? There's a time and a place for medicine, and it's really important, but I think treating the symptoms is different than, especially when something that's harming you. You know, people who are on a diet of naproxen, and then they can come back and say, yeah, actually, I just use CBD now, and I haven't touched an Aleve in how long, right?
And I think
let's do story time. So I want to hear your favorite cases that you guys have worked with and the most like awesome results that you've seen from patients.
And one of my favorite is the tremors. When these little old ladies would come in with a tremor, they haven't been able to drink tea in 3 or 4 years because they could never pick up the cup. And I remember one of our first cases.
That was the one I was thinking of too. Was
when we started them on a CBD elixir, which is an oral medicine. Sure enough, their tremors disappeared, and so she's now able to eat. Before she never. And the other things we find is the increase in mobility. They'll come in, they're all crippled up, they have to use a cane or a walker, and then next time we see them, they're walking in. And open up all those things. So those are one of the two favorites.
One time I had a couple come in, and the woman was stage 4 cancer. Her husband came in hoping to find something. They were just grasping and thought, let's throw cannabis in the mix. So the spouse was very stressed watching his wife go through this. She was very depressed. Obviously, she's basically, you know, having to really reconcile what's going on with her life. And so she was very low. They came in and she got her prescription. We talked about some terpenes that might be beneficial for managing pain. We went through a lot of really kind of in-depth looking at the medicine to see how it can be most therapeutic for them. So they came back in for a follow-up, and it was like talking to a different person. She was, her whole affect had changed, and her diagnosis remained the same. However, she was brighter, she was lighter, her pain was being managed, she was sleeping through the night, she was feeling on an emotional level much more stable and, you know, kind of more in that homeostasis. And her husband was brought to tears by just the change that had come over her and how blessed he was feeling because he felt like he had his wife back. And he thanked me and he said, I need to thank you. You've given me back my wife. And I was crying and he was crying and she was crying. And then Dr. Mitchell came in, I think, with that one. And that was the one where we were all, everyone was crying. It was initially, so a mother came in with her son. And she was really maxed out on every level with coping, and they'd been through every avenue and just nothing was working for him. She couldn't even get him in the car. He would
go in the car, and he was about 12, I think.
Yeah, he was
old enough he could take his seatbelt off and then start attacking her
while she was driving.
Maybe he was a little younger. Anyways, she couldn't take him to any doctor's appointments.
It was just their life was on lockdown, basically, and she was hanging on by a thread, I think. And so our initial appointment was with him, and we just talked about CBD, about using it safely. I recommended that he would take it to school even, so he had a dose several times a day. I think he ended up being BID or TID. And then we sent them on their way, and they always have access to help when they leave. So even after they have their initial appointment, they can call or email at any point for help. But we didn't hear from her. Like, I think she did really well independently, and then you saw her for the follow-up.
Yeah, she came back for the follow-up. It was a game changer. She would give it to the child for a swing, and about an hour and a half before she'd go anywhere, it became manageable. She could get him down to the doctor's appointments.
He was less anxious. He was sleeping better. Yeah. And less aggressive. The aggression.
And even happier.
Really,
they thought even his mood appeared to be. And he was a severely autistic child, and couldn't vocalize or anything along that line.
But yeah, she said his whole demeanor changed, and
so that was one of our
it was awesome.
So she went from he would be impossible to get into the car, he would take his seatbelt off, fight with her while she was driving, to now she can drive with him and he is
no problem.
No problem. And he was happily playing on his video game while he was here. He was totally fine.
Wow.
And versus the very agitated, anxious. She was worried it was getting dangerous, was what was happening, and she didn't know how to manage his care because it was just overwhelming her, and it changed their whole quality of life again.
Amazing. Okay, and then. Okay, let's talk about the process now. So how does someone become a patient and what's the cost?
So we do require a referral. That could be from their family doctor, nurse practitioner, or a specialist. Once we get the referral, then we can book them in for that initial consultation with our nurse.
Okay.
But a referral letter is okay as well. It doesn't have to be on the referral form.
Okay.
And once that is received, and we book them in for that consultation, all appointments that they get through us are free. It's covered by OHIP. The only cost to the patient would be for the product itself. And that cost varies depending on the products recommended. A lot of the companies do give kind of compassionate pricing breaks for patients in a lower income. So we always look at that for our patients and try and find the most reasonable product for them that we think would work.
Perfect. So this is a free consult. As long as the patient has a referral from their family doctor where they can access once you receive the referral form, you guys will set up an appointment with them. And this is completely free. And the appointment time is how long?
The initial consultation is 40 minutes.
Okay.
And then for the renewal appointments, it all depends. We kind of leave it open. Some patients are in and out in 5-10 minutes because they're good with what they're using, but then other patients might be another 40-minute consultation, depending on what the feedback is. Yeah,
what their needs are.
Okay, perfect. Okay. Okay, perfect. Okay. Anything else that you guys want to comment on that you think is really important for the future patients that are listening to this that they need to know?
Can I answer that?
Yes.
Okay. As a nurse, so it's my job. I spend 40 minutes with the patient, and as a nurse, it's really important, and I think I speak for everybody, all the nurses that work here. It's really important for us to spend time with our patients, to get to know what their needs are, what their circumstances are financially. It's a very holistic approach that we have when we sit down with our patients, because all of the variables and factors that impact their daily lives, when it impacts their ability to purchase products, how they access it, when, if they even can, and it's my job to help take them through all of that. So whoever is coming in here, comes in here, we sit down and we talk about how can we make this medicine work for you, and then it's my job to teach them and educate them on how to do it safely, and how to manage it and feel confident in that. And so that's something that I think MMJP does really well. They care very much about the individual. It's not a universal standard that we slap on each patient. Each patient is unique, and so how we teach and work with them is very individual. Would you agree?
Yeah, absolutely.
You guys are going to be setting up shop here in Hamilton. So right now you guys are in Fort Erie, and this is going to be your second satellite clinic. And like I said earlier, for patients that are interested, need their medical doctor or any specialist. Does that qualify as well? If a specialist gives them the referral, so if your medical doctor won't give you the referral, a specialist can count as a referral form as well. And I'm assuming all they need to do is sign off on the referral form. It's not a long process for the, okay, and start your journey to healing and decreasing potentially pharmaceutical drugs and improving your quality of life and all the other beautiful stories that I'm sure that they have withheld because we don't have hours and hours to discuss everything, but there's lots of potential and possibilities there. So thank you guys for taking the time to share with us about your company, about what you do, about the amazing results that you see utilizing this cannabis, this therapy, and in the safe and very unique perspective that you have of giving care and providing care in a controlled approach so that patients can see best patient outcomes. So thank you guys for sharing. And yeah, that's all I have to say. So thank you.
Thank you.
Thank you so much.
All right. Okay.